Um, so thank you for having me here and thank you for funding me for this very important research. So the topic of my PhD is investigating whether the mental health inequality between LGBTQ plus and heterosexual cisgender adolescents varies between schools and identifying the predictors of variation. And this is my very supportive supervisory team that consists of academics within and outside UCL. Now, adolescence can be challenging with a lot of mental health problems beginning during the teenage years. However, a group of young people that are twice as likely to experience depression and anxiety as compared to their peers are those who belong to the LGBTQ community. This LGBTQ plus mental health inequality seems to emerge as early as 10 years of age. It tends to peak at the age of 16 and tends to persist to adulthood. So it is important to note in this study that sexual orientation was also recorded at the age of 16. The distance between the two lines on this graph represent the mental health inequality between the sexual minority group and the heterosexual group. And the cause of this can potentially be explained by the minority stress theory. Minority stress theory helps us understand the extra stressors that come with being part of a minority group. Individuals who identify as LGBTQ may experience increased stress that is specific to their sexual and gender identity above and beyond the general stressors that are experienced by cisgender heterosexual individuals. This is basically just an outline of what the theory entails, but our study is specifically focusing on distilled stressors. Now, our focus is on understanding the variation in this inequality between schools. But why are we choosing to specifically focus on schools? So, before the start of my PhD, a rapid realist review was published by a team at UCL, and it found that the school climate, that is, policy, cultures, values, the school connectedness, that is, whether students feel belonging, acceptance, inclusion, and whether they engage with learning, and bullying and discrimination were potential explanations for this mental health inequality. This team also tried to better understand how to prevent or reduce this by working with an advisory group of LGBTQ plus young people. These young people advised that inclusive school environments which accept and promote diverse sexual and gender identities may reduce depression and anxiety. They also expressed strong support for universal interventions that are aimed at the whole school population because these do not single students out. Lastly, universal whole school interventions are also recommended by the Department for Education as the best approach to prevention. So, what we wish to do with all this information that we have is to first qualitatively understand the perspectives of secondary school students on universal school interventions. The review that I was referring to earlier identified some of these intervention themes. These were gender sexuality alliances, inclusive anti bullying and harassment policies, curriculum, workshops, and alliance staff trainings. We have a PPI group of young LGBTQ plus people who we consulted about our qualitative project and came to the realization that to improve intervention effectiveness, it is important that we engage cisgender heterosexual young students in the study. Therefore, we will be exploring the perspectives of both cishet and LGBTQ plus students through multiple focus groups. The second part of my study would In the second part of my study, we would aim to quantitatively identify modifiable characteristics of the school environment that are associated with this LGBTQ plus mental health inequality. The potential characteristics that have been identified and are also present in some of the data sets that we are using are school climate, school connectedness, bullying, and discrimination. We also aim to investigate the differences between sexual and gender minority subgroups and the intersectionality between sexual orientation and gender identity. In both of these projects, we also wish to account for intersectionality with other characteristics such as ethnicity and socioeconomic status. Ultimately, we hope that these findings will help us map out what school interventions should focus on to reduce this inequality and to benefit the different subgroups of sexual and gender minority young people, and also those who experience additional forms of marginalization. Lastly, these are the data sets that we will be using for our second study that our collaborators have kindly granted us access to. Thank you for listening. Thank you.